Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
I'm good. Thank you. How about yourself?
I'm doing well. We were just chatting, right? It looks like a beautiful day in Idaho for you today. So yeah, it's not that, I don't know about you. I don't get outside too much lately. So it's as much as I should. So it's nice to see out the window though, for sure.
Yeah, I hear you.
Well, I'm excited to have you on the podcast. I think we should dive right into it. I'd love if you could tell the audience a little bit about your background, and then we'll talk about nView.
Okay. Yeah. My background started my life thinking I wanted to be a surgeon. Went into family medicine. Became entranced by the idea of being closer to people. And over the years, have done multiple things. Helped with the initiation of some of the first National Health Service core sites in the United States back in the early 70s. Moved to Idaho to teach medicine. I was teaching at Baylor and moved from Baylor to here. Taught medicine, practiced here in Idaho for many, many years. Was the oversight for Medicare for 9 or 10 years, quality control officer with the Medicaid program here for several years. And started really enjoying, those administrative kinds of things. Began to get into the sort of the business side of medicine, but never lost my caring about how we did things and how we got better, how we improved quality, how we improved care. And so that's what led me particularly to nView, which is a company that develops behavioral health assessment tools, measurement-based care tools, and moves those tools from pure research, where they've been for many, many years in the worldwide research platforms, into things that primary care docs, nurse practitioners, PAs, pediatricians, interns can use in their everyday life to really improve the care of people with mental health issues. So in a nutshell, that's what we at nView have as our mission. Let's make mental health care better. Let's help the people who do about 80% of that work in the US, which is primary care providers.
What's interesting too is I mean, it's always been big, but I think as of recently with the emergence of like telehealth, right, it seems like behavioral health is one of the hottest areas of healthcare right now. There's lots of companies that are coming into this space, but more so just on like the, I guess, providing care to different patients, right? But so it's definitely a good time for nView, I'm assuming, based on everything that's going on in the world and for people looking at applications like yours.
Yeah, this has been a really challenging time for us in the research world. A lot of research trials were always people came into trial centers and did the work. That stopped around the world. So all of a sudden, everybody needed all of our tools in a format that they could send them out to people, or they could do them digitally. So we did a pivot in early 2020 to developing all of our tools on the worldwide research platforms. And then subsequently, as we all know, the pandemic surfaced, I think, a lot of mental health issues that were sort of under the surface for a while. Still, mental health has its problems with being stigmatized. But I think the pandemic, as you pointed out, really helped open people's eyes to the problems with stress and depression and social isolation and loneliness, and the ability to really focus on how people were feeling and how this isolation, loneliness, lack of support was affecting us. And we really see that as kind of the second tsunami that's coming now. And that tsunami is going to obviously overwhelm us if we're not careful. And in that, we believe that the first thing is really to help people find out what's bothering them. What's the first thing? I need to really understand, is this really a problem? And then I need to help my primary care friends get the right diagnosis. And that's what we do.
Who would you say is like your ideal customer that you're selling to?
We sell across a broad spectrum. We sell into the payer space. We sell and work with large organizations like EHR companies. We actually embed or put inside these EHRs some of our proprietary tools. And in many areas like OCDs and some of the children's areas, we are the gold standard in terms of what people use. So we're able to bring those into the workflow platforms for EHRs. We're able to bring them directly to people through our platform, and like in behavioral health clinics, a lot of behavioral health clinics use our tools straight off our platform because we can also export data into their systems very easily. So we have the ability to integrate at different levels. And so really anybody who's in the business of taking care of people and looking at both their physical health as well as their mental health together in sort of a 360-degree view, we can work with them. We can fit our stuff in. We can build it in. We can offer our platform. Lots of ways to connect.
I like that. Yeah, and it seems like the companies in the healthcare space that have really been the most successful have been flexible with like the different types of organizations that they can work with. It's, even though I think a lot of people that maybe aren't, we have some listeners that aren't directly in healthcare, so it's good to also mention this. We're always taught that you have to really just focus in on such a small part. And even though healthcare is massive, you still need to branch out a little beyond, you just saying we're going to sell to the EHR companies and that's it. But your platform can be, as you said, embedded into organizations like beyond that too. So why would you limit yourself to that? So that's really interesting. Can you tell us a little bit about some of the things you're really looking forward to heading into this year, or we're already in this year, but
yeah, that's a great point. As we've looked at it from a company, I think what we're looking to is really helping move forward with the concept of measurement-based care, because as has already been proven, people that use data and information, use measurement-based, evidence-based tools, the outcomes are better. So what we're focusing on is how do we use our measurement-based tools to support better outcomes, whether those outcomes are employer-based, as you mentioned. Is it an employer wellness program that needs more information to be able to help the individual employees? Is it primary care providers who need more information to get the right diagnosis and make the right decisions about treatment? Is it a payer who wants to provide better care and thereby reduce cost? So from that standpoint, measurement-based care for us is really sort of where things are focused, because on the flip side of that, we're moving to what's called value-based payment in this country. And value-based payment means I'm going to pay you better. I'm going to pay you more for better outcomes. Kind of a different approach than what we've paid in the past in the medical world has been, you do a procedure, I pay you for it. Doesn't matter how it came out, but you're going to get paid. Where now we move to value-based care by bringing measurement-based tools in, better value. That's what we're looking forward to being sort of the catalyst for.
Interesting. So you're expecting some. So you were able to handle the pandemic well, right? With that pivot you said in early 2020, or slight pivot. What are some of the things that you can announce today that like are on the horizon that you're really like excited about?
Well, we've added a whole number of really quality-based, measurement-based tools that have been developed by some of the leading psychiatric and psychologists in the world today. And we've added those to our platform. We've added the tools of Dr. David Sheehan, one of the leading psychiatrists. We have tools from Dr. Wayne Goodman in the world of OCD and autism with Larry Scahill, body dysmorphic disorder, some of the more complex disorders that Dr. Catherine Phillips has worked on and is the world's leading authority on. We've acquired the opportunity to deliver these so that rather than have a single standalone platform, we can have the flexibility to provide somebody what they need at the moment to deliver that measurement-based tool that is the gold standard in the world, and get them the right data on that individual patient at the right time. So we are adding those. We're adding more of those over time. We think this year the expansion of our advisory board, the ability to really create some unique opportunities to partner with other people who are looking at other data collection possibilities around healthcare, some of which are really quite what I like. They're cool technology. Some of the things that actually measure people's emotional responses at a physiologic level, integrating that with our data points to create a better picture of that individual patient. So those are some of the things that kind of are exciting us for 2021.
Yeah, and part of the goal too, Dr. Young, is to have you and other members of your team on the podcast again. This is really your intro podcast, right? Where we're for anyone that hasn't heard of you, right? They get a little bit of an intro, they get to hear about nView, and then we have you come on again, and we kind of go through some of these key areas of your business and dive into them a little bit more. Those are more deeper conversations, but this is a really good introduction to the Slice of Healthcare audience, and I'm glad we were able to do this.
Well, I appreciate the opportunity, and yeah, we would look forward to being able to interact with the wider community about some of the things that we think are important and some of the things that we think are pretty exciting.
Yeah, I'm excited. Yeah, we're going to be putting together some more behavioral health related content too, so it would be awesome to continue to have you on and as a guest, and maybe even put together some stuff on the live show that we're launching, which will be a lot of fun.
Okay, I'd look forward to it.
Awesome. Thank you so much for being a guest on the podcast.
All right. Thank you, sir.